Hey guys, and welcome back to my channel. Today I wanted to talk about how my first day at MD Anderson went and what you could probably expect yourself if you decide to go. So I went for a second opinion. I chose MD Anderson because of the medical professionals they have there, the doctors that specialize specifically in the type of cancer that I was diagnosed with 5 years ago. And I just felt like that was the right hospital for me at the time. I want to talk to you about how my first day went when I went there. So every day that you go to MD Anderson, you're gonna get a bracelet. I saved one of mine, but it has your name, your date of birth, your medical record number, and all of that. So it doesn't matter if you're having a procedure or you're just having a doctor's appointment, every day you're gonna get one of these bracelets. So I was expecting when I got there that I was going to see the doctor right away, but the first appointment that I actually had was with a nurse navigator, which was very helpful. We sat in a room and she went over everything with me from what I should expect day to day, how to navigate my way through the hospital, advanced directive, insurance and medical payments and payment plans, all of that stuff. There was some paperwork that was signed, and while I was in there, she handed me this little book, and this little book is a lifesaver. My first visit guide. I had bookmarked a few pages that were very helpful for me. It's very easy to navigate through this whole thing. What I really like about this little book is it has questions here for you to remember to ask your doctor. Like this one, meeting with your doctor. Here's a question that you can ask your doctor. What is my primary diagnosis? And they can better explain it to you. What caused it? A lot of these questions I wouldn't have thought to ask myself, so it was pretty helpful. She highlighted the patient advocate number that I can call if I ever had any questions. This is pretty neat because this breaks down the care team uniforms. So if you're walking through the hallway, which you're gonna be doing a lot of walking. I think like the first day my mom and I calculated over 15,000 steps. It's a pretty big hospital and it's connected to a lot of other hospitals. So this is pretty cool because it shows everyone in the different uniforms, and that way you can know who they are. If you're looking for a nurse, the all black scrubs, that's a registered nurse. Talks about My Chart, which is an awesome app, and I'm actually gonna do another video about My Chart and how to use it because it was a lifesaver, seriously. It has all of your lab results, all of your test results, has your billing on there. You can message your doctor all on this app. So cool. And I'm gonna make another video to show you guys exactly how to use My Chart. It was a lifesaver. Page on patient rights and responsibilities. Obviously pages on here talking about the financial obligations that you have as a as a patient. In the very back of the book, there are some pages that you can put your own notes in, which I found very helpful. I had put notes of the symptoms that I had at the time that I was there. Questions on how I wanted to know how exactly are we going to determine that this is this versus cancer. Another question that I asked there was how frequently will I need to come to MD Anderson since I'm in Indiana. So they also handed this paper to me when I was there, and this was the first day's schedule. So at 6:30 a.m., that's when I was in the office getting this guide. That was my first appointment at 6:30 a.m. 7:45, I had an appointment with the doctor. At 11:30 a.m., I had blood work. At 2 p.m. I had another consultation with another doctor, and after that I had a CT of the neck. All of these appointments, they had printed me out that paper before I had downloaded My Chart on my phone, and I didn't have to have any more paper after that because it was all on my phone. The cool thing about My Chart is that, say I had an appointment with such and such doctor at such and such time, but then they decided to reschedule it at the very last minute, which they did a lot. I would get a notification that, hey, your appointment was rescheduled. There was many times that I would get a notification that says, hey, we need you at such and such office in like an hour. So my chart is very useful. They handed me patient education flyers. That was just my first appointment, but it was a very useful appointment, and I still have this. You don't go to a hospital every day and get a full packet of information, and I just found it very useful. I hope it helps you. I hope you like this video. Give it a thumbs up if you did. I do plan on going back to MD Anderson once a year and seeing my other oncologists here in Indiana in between that. Anyways, that's it for this video. Thank you guys for watching. Stay healthy, stay happy, stay positive. I'll see you in my next video. Bye.